Hi, my name is Amy Lee. I'm the director of the Learning Resource Center and Simulation here at Minot State University's nursing program. Here is our newest lab. This is sometimes used as a classroom, but other times we use it as a lab or a clinical area for our nursing students to practice their clinical nursing skills. Here I have some of our mannequins that we use to practice on. This is our pediatric Hal. He's a 5-year-old pediatric patient. He is a high fidelity mannequin, so he can blink. You can listen to his heart rate, his lung sounds. You can take a blood glucose level on him. He'll talk back to you, and he really creates a real experience when you're taking care of him as a patient. Next to pediatric Hal, we have 2 of our lower fidelity mannequins, and we use them for nursing skills, practicing Foley catheters, doing intramuscular injections, administering medication, and kind of doing head-to-toe assessments with them. The bays are equipped with these head walls here, just like you'd see in a hospital, with compressed gas and oxygen so that you can put your patients on a nasal cannula or an oxygen device. Also, we have suction here too. I'd like to welcome you to Victoria's room. This is our high fidelity mannequin who actually delivers babies. It's pretty incredible to see. As you can see, she breathes, she talks, she blinks. You can start intravenous fluids on her, start an IV, and watch her contractions on the monitor here, and take care of her just like a laboring or a postpartum patient. Along with Victoria, we have her baby, which is newborn Tori. He cries, breathes, has heart sounds. You can actually check a pulse through the umbilical cord, which is pretty neat, very realistic for a high fidelity mannequin. Do head-to-toe assessments and everything else you do on a newborn. So our semester 3 students take a maternal and newborn class, and they're here for their 3rd semester. Our first semester students stick with the lower fidelity mannequins to practice their nursing skills, and then they move on at the end of their first semester to work with the high fidelity mannequin. And then the simulations are incorporated throughout the whole program in all of our courses. Here's our control room for our simulations. We can control both Victoria's, our maternal newborn room, and then SimMan, our adult health room. We've got cameras all around our simulation center so we can see what students are doing, and then we use those tools, we use those videos to look at after they run the simulation to debrief for the students to be able to identify learning opportunities and areas of improvement with their skills or how they've run the simulation. And I'll take you into SimMan's room. SimMan is another high fidelity mannequin that we use for our adult health classes, and that would be in their 2nd semester, and then throughout their 4th semester we use SimMan. And here you can listen to heart and lung sounds. You can put him on leads for a heart monitor. He talks, he cries, he has IV access so that you can give him fluids or medication, and we can change him out to be a man or woman depending on what the simulation entails. We also have this room set up to look like a hospital room, and we base that on all of our teaching instructors are content experts in the area that they teach, so they've worked in different hospital settings to know how the room should be set up, what supplies we need, what equipment we need, and what we need our students to practice with to be able to master to go out and work as a nurse once they graduate our program. Here's our debrief room. After we run a simulation, we always have a debrief for our students to be able to watch the videos. The videos don't go anywhere other than for the students to learn from and view. They're the only ones that view it, the people who are in the videos. And then we talk about opportunities for improvement. One of our labs that we have set up as half classroom and half hospital ward, where we have lower fidelity mannequins with headboards that have oxygen, suction, and compressed air for us to take care of the patients. Primarily, semester 1 students are in this room practicing their assessments on patients and doing their fundamentals in nursing course in this room. We also use this room as one of our labs for our nursing students to practice with the skills needed in the nursing program, such as medication administration. So if we're teaching students about medication administration, each student will have pills, vials, ampules, carpagettes, everything needed to actually have hands-on practice with demo dose or fake medications, but they look just like the real thing, which is a really nice thing for a nursing program to have, so that you don't only see it in the clinical area, but you have a practice with it in a safe environment, such as our labs here. We also turn this lab into, for our semester 5 students, which are our students getting ready to graduate, we turn it into a hospital ward and have 6 or 7 different patients in here for the nurses to practice their leadership and what it's going to be like when they graduate from the program and have jobs out in the hospital, taking care of patients and prioritization and doing all of those nursing skills again. We, at our Minot State University nursing program, we do prepare nurses. We have a pretty high pass rate for our state boards, the NCLEX that you take at the end of the program in order to obtain your registered nurse license. Our nursing program can, each semester can hold 24 students. Right now our semester, our class sizes range from 15 to 23. Throughout our nursing program, the students progress through different stages. The first kind of step is to learn the fundamentals of nursing and head-to-toe assessment. During that, they use the mannequins to practice their assessments and their fundamentals on. At the end of their first semester, they start going out to clinical sites, whether it be assisted livings or hospital clinicals, and the hospital clinicals really include every area in the hospital. Maternal newborn, pediatrics, emergency, the med-surg floors, and ICU. We also do outreach with schools for pediatrics and mental health and other facilities to get the hands-on clinical experience with real patients. So we practice in a safe environment here at school, and then hopefully you take that skill and knowledge set out to your clinical practice with your real life patients.